Today I'm going to give you a little update to the match process. I know we have like three kind of category people who are sitting, who are interested in residency in future. Like first category is those who are applying for match this year, and they will start residency in July 2021. I had to make this 2021, and other candidates who are applying match next year, so they start residency in 2023, and then other candidates who are in medical school. So we have three categories. So this is the most this is, I'm presenting most of those who are applying for this year, like in September, and they will start in 2022. So before applying for residency, uh, it's always better to be ECFMG certified. As a Dr. Raza mentioned that without ECFMG certification, when if you are a US graduate, if you took step 1 or CS, you can apply. But program does not review application until application is totally completed, which include step 1, step 2, CS and CK. Now there's no CS because it has been suspended secondary to COVID. So, in response to suspension of Step 2 CS by the USMLE, so now they started 6 pathways has identified that will allow qualified IMGs who have not passed Step 2 CS to meet the requirement for ECFMG certifications. So, there are five pathways, but last night I was looking, they also included pathway 6. And so I will talk a little bit about on pathways. Pathway 1, already licensed to practice medicine in another country. In pathway 2, already passed or standardized clinical skill exam for medical licensure. And in pathway 3 is medical school accreditation by agency recognized by World Federation for Medical Education. And pathway 4 is medical school participant in US federal student loan program. And pathway 5, medical school issues degree joining with the US medical school accreditation by License Committee on Medical Education. And pathway 6, this is a new pathway, evaluation of a clinical patient encounter by licensed physician. To meet the requirement for pathway 6, the applicant's clinical skill must be evaluated by a licensed physician using ECFMG mini clinical evaluation exercise for pathway 6. So these are the 6 pathway by which candidate can be ECFMG certified without CS. So now they included, like, this is the English language proficiency assessment, OET, which we call. This is for those candidates because we cannot take CS. So now you have to take OET, or if you come in any category of this pathway. So applying for OET medicine, so you can take OET even last night I was looking. So this is the website. You can also take exam in Pakistan and all around the world. And it's I think most of the time I never took, so I'm not have I don't have much experience how, but from my understanding mostly they see your English. There's no patient encounter or anything like in clinical skill. They have certain trial stations. They see your professionalism, communication, patient encounter, how you're encountering the patient. So now I will talk quickly on pathway 1. These are already licensed to practice medicine in another country. So application has held a license registration to practice medicine without supervision in any country at any time or after January 1st, 2015. So these are the candidates who are working as a licensed physician in a different country. So they are exempted to OET and CS. ECFMG will certify them. And pathway 2, already passed or standardized clinical skill examination for medical licensure. So this is these are the candidates who done PLAB 2. It's in the UK, and AMC, Australian Medical Council Part 2, or workplace-based assessment, and Medical Council of Canada, MCC, which we call. This is also Part 2 exam. And in New Zealand, NISRAX clinical, and that is also when you do, you can exam these all CS. and Medical Council of Ireland. You know, step 2 CS is very important exam. And when I came here, I was told that and this was my also experience after I done exam. It's very easy to pass and it is very easy to fail. If you prepare very well, it's very easy to pass. And because the passing rate of CS is 95 to 96, if anyone fails, it looks very bad on the CV. It is totally red flag. So program director will look, oh, this 96% people can pass, but this candidate couldn't pass. So there is some problem with this candidate, like communication skill. As Dr. Rosa mentioned, that communication is very important. Being a clinician and being a researcher, being a physician, if you could not communicate to your patient, patients usually don't appreciate that. So communication skill is very important, and this exam really teach you a lot. When before I was taking like step CS, and one I did observership, and once I did my step to CS, you know, I learned a lot of things: how to encounter patient, how to introduce patient, how to counsel patient, how to quit smoking cigarette, this and that. So that also that these all things I was taught during my step 2 clinical skill preparation. And pathway 3 is a medical school accreditation by agency recognized by World Federation for Medical Education. So these are some medical schools that are recognized by WFME, that is also exempted, so they can just take step 1 and step 2, and they fulfill their criteria, and they are ECFMG. It is also coming in the ECFMG requirement. And pathway 4 medical school participants in US federal student loan program. And there are certain medical school, they are participants in the US federal student loan program, and that is also exempted. uh, and pathway 5 is medical school issues degree jointly with a US medical school accreditation by LCME, like the Well Cornell Medicine in Qatar and Duke in Singapore. If any candidate is coming from there, uh, they also don't have to take step 2 CS because of the way they teach. They train their candidates. Uh, they're exempted. And pathway 6, this is a new pathway: evaluation of clinical patient encounter by licensed physician. So pathway 6 is for application who do not meet the eligibility criteria for pathway 1, 2, 3, 4, or 5, or have failed step to CS one or more times. To meet requirement for pathway 6, the applicant's clinical skills must be evaluated by licensed physician using SFMG mini CX for on pathway 6. So this is the website from where you can get more detailed information. And step 3 is also very important before suspension of CS. So those who are the eligible for step 3. So the candidate who took step 1, step 2, and CS and CK, when you are ECFM certified, then you are eligible for step 2, step 3. But now you cannot take step 2 CS. You're not ECFM certified. So now they gave you option that, you know, you can take step 3. You have a medical degree, passing step 1 and step 2, being ECFM certified. If you're an international medical graduate, have taken all your assembly component, not failing step 2 CS or more times, this temporary eligible criteria will go into effect in early September 2020 with a specific date to be announced. And so there's one change is coming from January 2022, that change to pass fail score reporting for step 1. So the USMLE will change score reporting for step 1 from 3 digit to numeric to reporting only pass or fail outcome. So this policy will take effect earlier no earlier than January 1st, 2022, with further details to follow later this date. So this means that from January next year, uh, Step one would be like just pass or fail, like CS back in days was pass and fail. uh, I was discussing with my other colleague that if they are doing just pass or fail, so they will increase the passing bar. So now it is 186, or I think 188 is a passing, maybe a little bit more for step one. From my understanding, they will increase a little bit more. And step one is always challenging exam, because a lot of basic science in step one, which we did in our medical school first year and second year, and in third year, fourth year, we don't read basic science. So they ask a lot of basic science, and the candidates who are good exam taker, they were doing outstanding score like in 250s, 260s. So now the most important thing is this: if it is going to change in pass or fail, now step 2 CK and step 3 is very important for IMGs. So now you have to do very well on step 2 CK to improve yourself, that you are a good clinician. So the numeric I score will continue to be reported for step 2 CK and step 3. This is what I was discussing, that program director, now they will look step 2 score and step 3. Step 3 program does not ask you to take step 3 before when you apply for residency, but it will give you a big advantage. For instance, if you're applying in a program where they took a lot of IMGs, so they rank those candidates who took step 3 and with good score. Because when you are in residency, especially first year, it's very challenging as an intern. System is new, everything is new for us when we come from different country. So, and again, you have to take step 3 end of your first year, or start of your second year, or middle of your second year. So some people they take a few times off, few days off for step 2 3, and then they are focusing on the studies when they go home. If you have already done step 3 before starting our residency, you don't have any more headache of any exam during residency, except in service exam every year they take during residency. So it will give advantage uh, when they rank you. So step 1 and step 2 CK content distribution changes, that was changed last year. USMD announced the content distribution changes on step 1 and step 2 would be delayed until September 2020. So it was already begun in October 2020 and begin in November 2020, because in step 1 they have increased the number of item assessing communication skills, and in CK they increased the number of item assessing system-based practice, patient safety, legal, uh, ethical issues, and professionalism. So these are some changes they put in step 1 and step 2. So that was all for the ECFMG certification exams. As Dr. Raza mentioned, score is very important, and uh, it is very important. The replication comes open on the basis of score, and then second things they look your letter recommendation, your CV, your research applications, and all other things. But first thing they see, this is how they filter your application on the basis of your score. And from my experience, score and interview skills is very important. When you get interview, it regardless of whatever your score is, that don't see, like for instance, if anyone who's recommending you for interview, for instance, if you get an interview with anyone recommendation, take that interview very seriously. Don't think that that was a pulled interview or something like that. These people, they don't have a time to invite those candidates who they don't want to take. For instance, they invited you means they are looking forward to hire you. So now they want to see you what you are. They already reviewed your application, and this is how they invited you for the interview. So now you have to you have to perform on the day of your interview. I think next after a few one of our presenters will present interview skills. That is very important, how you are going to present yourself. Be nice, be humble, be genuine, and you know about your CV, what you have written in your CV. Sometimes uh, we have wrote everything in our CV, but when on the day of interview they are asking, "Oh, tell me about this research experience you published, and you were first or second or third author," they are blank. They are like totally blank out, and they don't know what's that. So uh, it's also very bad when they ask these things. So when I went for my residency interview and when I went for my fellowship interview, I always review my CV a night before for my interview. It will refresh what you have written in your CV. So score an interview, and then in the between letter of recommendation, research, publications, all things are plus in your CV. And so this is the 2021 and 2022 residency application cycle. So I think the most important thing is from June, start your program search. So where you would like most of our IMGs they apply and more than 100 programs, and it's very expensive. And sometimes we don't research program, we just throw application. Their um, their score is very high, of 250 to 60. They don't sponsor visa. So and their year of graduation is less than 3 year. Or sometimes if we are more than 5 year scores, our score is not fulfilled program criteria. And uh, year of graduation, visa. So start program search just to save your money. I know it's a very time taking process. First time I when I applied, I did not match. Second time I applied, I did not match. So then I start doing researching of the program, where I have to apply and what are the programs, how I have to communicate with the program. That then second, third time when I was applying, I was calling program coordinators that these are my scores and this is my visa status. Would you consider my application? They say no, we don't. I was not applying because I need to now save my money. So this is what you should do. So then I made a book, I was talking to program as in June, July, and I said, I'm applying in September. Would you entertain my application? They said no. If anyone says yes, we will. And then I was sending them email right away that I'm applying in September. I look forward to hear from you. So and then I applied and I was communicating same email that I talked to you in July, August, and I applied. Can you please take a look at my application? Then I was calling to the program coordinators, and this is how it was a lot of hard work, but that's the best way if you have time. And then from July to August, prepare your residency application. I guess Dr. Raza mentioned that residency application is very important. What you are going to put in your application, and that is the most important thing. This is how you get interviews. And from August 15 to 2021, uh, OSS document submission date to have documents ready before application starts. So this is I'm sure whoever are applying, they know about OSS document submission. And so you have to sometime, last year my wife applied. Her letter of recommendations were not uploaded because she uploaded a little bit late. What I did, what we did, she was calling to the ECFMG, and this is how they were expediting the process. Uh, it's better to have everything uh, in your ERAS before you send application to the program. On September 2021, apply to residency program and register for NRMP. And I think this year, September 1st, 2021, starting at 9 a.m., RAS allow residency application to certify and submit their application to residency program. So program will not receive the application until September 29th. So because um, after that, as they will receive medical MSPE, then they will review your application. So but you can send your application from September 1st. Just make sure, read this, like application to certify and submit. Once you certify and submit your application, you cannot edit anything in your application. So always read about your application few times. In addition, I would highly recommend, if any of your colleague or if any senior mentor, send them your application. Sometime proofreading also helps. Sometime if when we do by ourselves, we cannot catch our mistakes, typo. Send your application to your colleague, your seniors, your mentor. If they have a time, they can quickly review your application if there are any typo or anything. So application release and interview start. So March 2022, this year or next year, match week and the post match soap, uh, an NRMP rank order list deadline, and that is the last day to register for NRMP. So this next year, match day is 14th March, and match week begins and post match soaps kicks off. So now, well, for instance, if any candidate who did not match, so what now they have to do, like post match soap. So step one is get your list of unfilled program from NRMP. Whoever you all will see which programs went unmatched. Then you can apply. Again, focus in those program. Always research the program, who which program can should is taking to the IMGs, which program is IMG friendly. For instance, sometime uh, university program goes unmatched. If you're sending your application in university program, they're not going to entertain you. They will enter into US graduate. So always search your program. For instance, in SOAP, if you're sending your application, will they review your application? In addition, the most important thing is networking. Ask from your around that, is anyone over there in the program? Find out they can help you with that, and obtain your program and compatibility search access from electronic residency to help you research and pick the best program from your list of unfilled program. And step three is at around 12:30. Log into RAS and start selecting your 45 program and sign your documents and apply once you are sure you have chosen the right program you qualify for. And wait for the interview from the unmatched program. Uh, these are some official website resources. ERAS will give you everything, and then ESAFMG, they have mentioned everything, and NRMP and usma.org. So these are the most resources from where you can get all major information.